A lot of prostate cancer treatments come with a warning. You might lose your erections. What most men never hear is that your odds depend almost entirely on which treatment you pick. With surgery, more than 65% of men over 70 end up permanently impotent. There's another treatment where 76% of men keep their erections. And most men never see these two numbers side by side before they decide. A lot of men feel awkward even asking about this, like they should be just grateful to be treated. You're allowed to want both the cure and your sex life. I'm Dr. Ajay Bhatnagar. I'm a radiation oncologist, prefer to be called an interventional oncologist, and I've treated more than 15,000 men with prostate cancer. In this video, I'll show you why the treatments differ so much and the exact questions to ask your doctor before you choose. Here's the mechanism, because it's the part that actually explains the 76%. Radiation delivered from outside your body has to pass through surrounding tissues to reach your prostate. That path runs near the neurovascular bundle, the nerves and blood vessels that control your erectile function. They sit just outside your prostate wall. When external beam radiation travels through your pelvis, some of that dose reaches those bundles. You can aim carefully at your prostate, but the radiation still passes through what's in the way. Surgery works differently, but runs into the same structure. Removing your prostate requires working right next to those bundles. A nerve-sparing approach means the surgeon tries to avoid cutting or damaging them. In skilled hands, the technique succeeds more often than older methods did, but those bundles run close to your prostate. A surgeon works in a narrow space, and the outcome data in men over 65 still shows permanent impotence in more than half of the patients. With brachytherapy, seeds go inside your prostate. The radiation goes out from the center. Your neurovascular bundles sit just outside your prostate wall, right at the edge where the dose drops off sharply. The seeds emit energy in a tight radius, spending most of it inside your prostate. The bundles get very little of it. That's what produces the 76%. The difference is geometry, not surgical precision. I also do peripheral seed loading during the procedure, which means placing the seeds in the periphery, far away from the urethra, rather than directly against it. That protects urinary function. And I place a rectal spacer called Barrigel at the same time, a gel between your prostate and your rectum that lifts the prostate off the rectum, holding them apart, reducing radiation exposure to the rectal wall. Both are done in one appointment. The 98% plus cure rate and the 76% rate of men who keep their erections come from the same source, the radiation that targets your prostate from the inside out, without reaching the structures around it the way external delivery methods do. Ricky was 59 when he found his way to my office, a fitness trainer in Atlanta. He'd been told surgery was his only option. His surgeon mentioned nerve sparing and said it would give him a chance at keeping his function. A chance wasn't what Ricky was looking for. He had a career built around his body and a life he wasn't prepared to hand over to a side effect. He flew to Arizona, had the procedure, drove home the same day, and was back training the following week. His cancer is gone and his erections are intact. That didn't happen because he got lucky with a surgeon. It happened because he found a treatment with a different mechanism and a different outcome profile. Most men never get to make that comparison because nobody puts the numbers side by side for them. Most men don't know how to ask about their erections in a consultation without it feeling personal rather than medical. Here's how to make it clinical. Ask your doctor, what percentage of men with my age, with my Gleason score and stage, keep their erections with each of these treatment options based on the published data? That question asks for numbers by treatment specific to your profile. A doctor who knows the data will give you the numbers. One who doesn't will give you something vague and that tells you something about the consultation you're in. Then ask specifically about brachytherapy. Ask whether you qualify, whether your prostate is under 60 grams. Your urologist already has that measurement from your evaluation. Call and ask for it. If you qualify and Ask what rate of men who keep their erections looks like for your risk group with brachytherapy compared to surgery and external beam. Get those three numbers before you make any decision. And if your doctor tells you that keeping your erections isn't the most important consideration right now, push back. You're asking which treatment gives you the best chance at both the cure and that outcome. A doctor who can't answer it with data is worth a second opinion. You came into this diagnosis prepared to sacrifice something. Most men do. The better question is what the full picture actually shows for your case before you decide what to give up. The number for brachytherapy is 76%. For surgery in men over 70, more than 65% go the other direction. That gap is the reason this question is worth asking before you decide, not after. If you've been told you need hormone therapy before or alongside your radiation treatment, watch this next before you agree to anything. It's called Before You Start Your Prostate Cancer Hormones, Watch This.